Hi there, my name is Dr. Bruce Muth, and I'm here to introduce to you some uses of therapeutic laser and how we use the laser to treat certain conditions in some of our pets. So today what we're going to use is we're going to use the brand new, just released Microlite 830 Smart Laser. It's a neat little laser. It's very compact and portable. It's programmable. It's got a really cool run indicator light. So let's show you some indications that we might use a laser for in a dog. We've got a little demo dog here. His name is Reese. And so what we're going to do is we're going to say treat a stifle. He's got an arthritic stifle. We're going to palpate the patellar ligament and find that in the cranial aspect of the stifle, and then direct it into the joint from medial and from lateral, directed caudally into the joint. We're going to input 6 joules in each spot. Now, you'll know that the laser's working for you when we turn it on and we start a cycle. One cycle lasts 33 seconds, puts in 3 joules of energy. And you'll see how the indicator light tells you that the laser's working. It also has an audible beep which you can turn on and off. We'll also use a laser commonly when we're treating hip arthritis or hip dysplasia. So we'll find the hip bone and we'll come cranial and find the greater trochanter. Same thing as the stifle. We're going to go cranial, directed into the joint, and caudally, directed into the joint, and we're going to input 6 joules of energy at each of those spots, so 12 joules total. We'll occasionally see a dog that gets bursitis in their shoulder. You'll feel that pain when you palpate them, their bursa as it runs through the groove in the humerus. And the shoulder's a little simpler. We'll input the energy, 6 joules only from one spot, directed caudally across the bursa and into the joint. And a really common use that we have for the therapeutic laser is in back injuries, intervertebral disc disease, super common thing that we see. So we're going to treat the affected area. So let's say in this dog he had lumbar back pain, intervertebral disc disease. We will find the lumbar vertebrae and we'll identify that as the caudal aspect of the ribs to the hip bones where the hip joins the sacrum. And we'll use 1 width of the therapeutic head at each spot. Now, on a small dog like Reese, we might be able to cover his whole lumbar spine with 4 spots. But if you have a large dog, you might have to use 6 spots, 8 spots, or 10 spots. That'll affect your run time. But you'll see that as we do it, we'll find it, palpate it, put it straight on the dog. The dog is very tolerant of it, and it's easy to do. So the laser works wonderfully in some of these conditions. And so in summary, arthritic joints, some wound care, sometimes ear hematomas or ear infections, and back injuries are some of the really super common ways to use a laser for therapy and really help some of these arthritic or painful animals out.
Well, Dr. Muse, thank you so much for your time this morning and sharing your experience with the Microlite Smart Laser.
Thank you.